Hi guys, welcome back. So for those of you who have seen some of my previous videos, who maybe have subscribed to my channel, you will have seen that I've done a few posts quite a while ago now on specific muscle groups and, for example, the calves, the quads, and talked about why injuries happen, why those muscles get strained, what causes them, what the symptoms are, and how you can treat them. So today's going to be another one of those videos. I'm actually going to be talking about the hamstrings today. Now the hamstrings are a group of 3 muscles which extend along the back of the thigh from the hip to the knee, and they're used during running, climbing, jumping, to flex the knee, to tilt the pelvis, and also to help twist the knee while it's in flexion. Okay, so if we look at the diagram here, you can see 3 muscles there on the back of the thigh. So the muscle that sits most laterally on either side here, and this one here, that is the biceps femoris. And then in the middle here you've got the semitendinosus, and on the inside, more medially, lying just underneath that, you've got the semimembranosus. Now the hamstrings also work alongside the glutes, helping to extend the hip when you stand up. And so injuries to the hamstring can be quite common because they are often being simultaneously used for hip extension and knee flexion, for example when sprinting. So what happens is, in that case, each end of the muscle actually draws closer to the other. And so this then increases the tension in the muscle, making it more prone to injury. So if we look at the causes of a hamstring strain, anything that stretches the muscle beyond its limit, but also sudden explosive movements or change of direction. So if we look, we mentioned there about sprinting, but also sort of jumping, a lot of sort of these CrossFit type exercises, or in sports such as football or rugby, where you could be sprinting but have a sudden change of direction, to avoid one of your opponents. The also recurring injury is going to sort of often be a cause. So it could be that you're maybe injuring the glutes and then your hamstrings are compensating, or if you've sort of had a previous hamstring injury, you're certainly going to be more prone to getting another injury in that area. But if we think about sort of athletes who are sprinting again, it's in that time just before that outstretched leg hits the ground, the hamstrings have to suddenly contract to bend the knee. And so that is a common time when these injuries are going to happen. So risk factors, as we've said, previous hamstring injury, you're looking at probably up to about 1/3 of all hamstring injuries are down to there having been a previous injury there. Muscle strength we need to look at. So, obviously, as we know, the hamstrings and quads kind of counterbalance each other. If the hamstrings are mainly weak, then you know, that lack of muscle strength there is going to make them prone to injury. And again, especially if you've got hip extension and knee flexion simultaneously. But, you know, any imbalance between the hamstrings and quads will put either of those muscle groups at risk of injury. Injury is certainly less likely, you know, if you are an athlete, you know, if you warm up and do some stretching beforehand, injury is less likely to happen. And also, you know, we've got to think about sort of energy levels in general. You know, if an athlete's going out there tired, not had much sleep, you know, again, it's going to be more prone to injury. And if we look at footballers, you know, they are more prone to injury in the second half of the match when they're more tired. Overall fitness obviously is a factor, core stability and flexibility, and obviously, you know, the older you get, you're naturally going to be more prone to injury. But also, if we look more at sort of occupational or lifestyle habits rather than sports, then we're looking at someone who maybe sort of has prolonged periods of sitting. So, for example, if you're a taxi driver, you know, this can cause weakness in the glutes, which will then increase the amount of stress and impact on the hamstrings, making them more prone to injury again. So if we look at hamstring injuries, you know, the main thing really, we're looking at hamstring, the strain of the muscle. So as if you've seen my quad or calf videos, I explain muscle strains. You've got 3 grades. You've got grade 1, grade 2, grade 3. So grade 1 would be a mild strain where there's a sudden pain at the back of the thigh, but the muscle strength really shouldn't be affected. And, you know, recovery literally a few days. But then a little bit more severe is a grade 2, which is a partial muscle tear. So whereas with a grade 1, it's just a few of the muscle fibres that are strained. In a grade 2, you know, you're potentially looking at half of that muscle, you know, that half of those fibres have been pulled. So this is obviously going to be more painful. There's going to be swelling and bruising at the back of the thigh, probably some loss of muscle strength, and this can take anything from a few weeks to a few months recovery. So it's really important to get that rest time in. And then the worst muscle strain is grade 3, and this is where you've got a complete muscle tear. So the whole muscle is ruptured at one of the attachment points. You're going to know if you've done this because it is going to be extremely painful, and you're going to have a lot of bruising and swelling. Sometimes as well, rather like when you sort of tear a ligament, you might hear a sort of a popping sensation at the time of injury. There will certainly be loss of function, and again, this is you're probably looking at a few months recovery. Now, there are certain areas where a hamstring strain is more likely. So if we think about common sort of sites where a muscle strain will happen in the hamstring, we're certainly looking either in the middle of the back of the thigh where the muscle meets the tendon, or at the base of the buttocks. And looking at this picture here, you can see sort of where you tend to sort of feel sort of compensatory pain, and sort of where you're going to feel the pain, you know, when you do an injury. So we're looking at the back of the knee there, sort of at one attachment point of the hamstrings, or we're looking sort of mid to upper back of the thigh, or sort of around those glutes. And so, as we've said, in terms of symptoms, certainly there may be a bit of a popping sensation at the time of injury. Most certainly you're going to feel some pain, which obviously varies depending on the grade strain that's occurred. Certainly there's going to be a lot of tightness, a lot of tenderness, possibly quite a lot of inflammation if you're sort of towards a grade 3. Muscle spasms and cramping, swelling and bruising, which certainly is going to be probably noticeable on a grade 2. On a grade 3, that is going to be a significant bruise on the back of your leg. You're most certainly going to have difficulty walking, probably with a grade 2 and a grade 3, and some loss of function, which again will be according to the grade of injury. Now, in a grade 3, certainly you may also feel a gap in the muscle. You may sort of quite easily be able to palpate that. So that is another pretty clear sign that there's been a muscle rupture. Now, in terms of recovering, if we're looking at those sort of grade 2, grade 3 hamstring injuries, certainly these are going to take longer to recover from. As we've said, can take a few months, and these potentially could be debilitating enough to actually end a professional sports career. So again, it's really important to have that rest period and to really not do anything silly during that recovery process, because you could actually really end up doing yourself an even worse injury, and then never being able to play the sport that you love again. So in terms of when injury happens, treatment is really the sort of standard sports injury treatment. So we're looking at the RICE protocol. So you've got rest, you want to avoid physical activity. It may be that in cases of certainly a grade 3, you may need crutches in order to be able to mobilize. Ice, applying ice packs for up to 20 minutes every 2 to 3 hours, certainly in a grade 3, to reduce the blood flow and therefore help reduce certainly the inflammation, and also in those sort of immediate post-injury stage, it may help also reduce some of the pain. Compression, you can use like a bandage or support to the thigh, again to help just reduce the swelling and inflammation. And of course elevation, keeping that leg elevated as much as possible just to help reduce that swelling. And also of course non-steroidal anti-inflammatories for pain relief, taking care of things like ibuprofen if you have any gastric problems, because it is a gastric irritant. Certainly in those early stages, in those first sort of couple of days, do avoid hot baths, because that's really going to just promote all that inflammation. Is going to increase blood flow, and it's an already inflamed leg is going to feel even hotter and more sore. And again, that goes for heat packs as well. Don't use a heat pack for pain in the first few days following a hamstring strain, because again, it's just going to increase the blood flow to the area. Also alcohol, probably one that you wouldn't think of. Again, alcohol, can increase bleeding, and really just slow down that healing process. So best to steer clear. Obviously you should be resting anyway, but avoiding any running or any exercise that can cause further damage. And also in those first few days, you actually really want to avoid massage, because again, that can actually increase the swelling and the bleeding in those first few days. So rehabilitation is really important in terms of reducing the risk of a repeat injury, because as we've already said, up to a third of hamstring injuries is, due to a previous injury. After 72 hours, you can have physiotherapy or sports massage, but obviously if there is still inflammation there, you probably want to wait a little bit longer. And in the case of grade 3 tears, where there is a complete rupture, you may be looking at surgery to correct that. Now, in terms of recovery, you can start doing a few gentle exercises after a few days once the pain has eased and the inflammation. Any quicker, and again, you could worsen the injury and end up in a far worse condition. But on the other side of it, leaving these exercises too long can cause the muscle to shrink, and especially in a grade 2 to 3 injury. And so what happens then, if the muscle starts to shrink, it can become encapsulated in scar tissue, causing further tension and further affecting muscle function and range of motion. Once you've started doing these gentle exercises, you can then start to introduce walking and cycling. But again, just introduce these things gradually, again, just to avoid, any chance of further injury. And obviously, warming up, cooling down when exercise is reintroduced. And if anything is painful, stop. Don't push through it. Be sensible. Listen to your body. A grade 3 tear certainly is going to take longer to heal. Unusual training, if you're in a sports team, is not going to be possible until, you've got some of that strength and flexibility back. So you really do need to, comply with the physio program and just build things up gradually. Now, in terms of prevention, how can you prevent, hamstring strains? What exercises can you do? Well, there are lots of hamstring exercises, and doing these exercises will certainly help to maintain muscle strength, maintain flexibility, and help, therefore, prevent re-injury. And it will also ensure that both hip extension and knee flexion functions of the hamstring are worked on. So it's important to select, if you have had an injury, to select your exercises wisely so that, you're working on both of those functions to really, get the hamstring function back to where it should be. So I'm going to now talk about some hamstring. Okay, so a really good preventive hamstring exercise are these Nordic hamstring exercises. And if these are done regularly, they can actually prevent repeat injury by up to 85%. Now, you do want to gradually increase frequency and repetition to avoid delayed onset muscle stiffness. So, to do the exercise, you simply kneel up with your hands in front of you to ensure that your feet are held down at the ankles. And then you're going to lower yourself towards the ground as slowly as you can. And when you can no longer hold yourself, drop down to the floor, but use your arms to push yourself back up immediately. Do not use your hamstrings to get back up. Now I'm going to go through some exercises. I'm not going to explain each one of these, but you know, you can Google them if you know, you like sort of the look of it, or you want to find out more about how to do it. So in terms of pre-workout stretches, you've got the lying L sit, which is pictured here. And then you've got the kneeling half mountain climber bow draw. And you've got the lying warrior. So all of these are really good stretches for before your workout. Now, as I said, you want to ensure that you're getting a combination of exercises to work both the hip extension and the knee flexion functions of the hamstring. So to work hip extension, you can do a Romanian deadlift for those of you who are gym goers. And if you haven't already looked, there's my Gains Without Pains videos, and there is one on the Romanian deadlift which talks about good technique and how to avoid injury while doing those. Or you might want to do a back extension exercise, or you can do those kettlebell swings. So all of those will work the hip extension, you know, really well. Then to work the knee flexion, something like a lying leg curl, or even a you know, if you've got like a home gym, a standing leg curl will also work the hip flexion. And if you want exercises to work both hip extension and knee flexion at the same time, then get yourself a Swiss ball and do a Swiss ball leg curl. Or you can do a similar type exercise with these sort of slider plates. Now, if you want to work both the quadriceps and the hamstrings at the same time, then you can look at something like the Bulgarian split squat, or you can do those walking lunges. So that's really all the information on hamstring injury and strain. Hopefully it's just given you a sort of good all-round knowledge of how to treat them, how to avoid them. And as I say, really the most important thing is just taking that recovery process slowly, building back up the exercise gradually to avoid, you know, additional injury. As I say, there are other videos up already on the quad muscles, calves, glutes. So if you're not already, you know, feel free to take a look at those. You can subscribe to my channel and you'll be notified when other videos come out. There's lots on there about sports injuries, medical conditions, pregnancy related issues, all sorts of things on there. So do take a look. Feel free to comment down below, or you can message me if you have any questions. Message me through my Facebook or Instagram. On there is the Medical Massage Lady. And if you are another therapist and would like to do some training on sports injuries or anything else, you can take a look at my courses on www.medicalmassagelady.com. Or again, you can contact me through my Facebook or Instagram and I'll answer any questions that you have. But for now, that's really it from me. So hope this helped. Take care and I'll see you next time. Bye.